A stroke is a common but serious medical condition that requires emergency treatment. A stroke happens when part of the brain doesn't get enough blood flow. Fortunately, strokes are preventable, most of them, and Dr. Sarah Schwertner joins us from Primary Care Plus to talk about the signs of a stroke, what to do about it. Good morning to you.
Good morning.
So we sort of defined it there, but this is a narrowing of the arteries that cuts off the blood flow, or what?
Well, a stroke can be either from a clot or even bleeding, where your cells in your brain lose oxygen. So if that isn't taken seriously as an emergency in the right amount of time, you can have permanent damage.
And you have a very small window
Yes,
to
we
act.
do. Right.
And if you feel a relative is having a stroke, I mean, how much time do you have?
It just depends. It depends on how big the stroke is, where the stroke's located. So the most important thing is to know the signs and to call 911 if you think there's a stroke.
Well, what are the signs?
So some of the signs might be headache, weakness on one side of the body, numbness or tingling. You can also have paralysis. You can have slurred speech. You can also have confusion and even heightened emotions.
You can have everything from, a complete recovery to long-term complications.
Right. So like I said, if you get it taken care of early, then you can have a complete recovery. But long-term, you can be permanently paralyzed. You can have trouble speaking, have trouble doing your normal everyday functions.
How common is it overall?
So actually it's pretty common. So it's the 5th leading cause of death in America, and it's also the leading cause of permanent disability.
And the risk factors, weight obviously comes to mind.
Right, and some of the risk factors, age is one of the big ones. So being 65 or older, you have an 80% more chance of having a stroke than someone younger. Also, not controlling your blood pressure, not controlling your diabetes, and having high cholesterol.
Okay, Doc, I want to lose a few pounds, and the point is we should lose a few pounds. If you're packing an extra amount of weight, that makes it that much more likely that it could be stroke or could be heart conditions.
Right. So normally, weight goes along with having high blood pressure, having high cholesterol, having diabetes. So getting those under control, as well as exercising, is great prevention.
That's a great point. I read an article a number of years ago about how some people are, I think they put it in pretty blunt terms, skinny fat. And the thought was that, you see some people who appear to be trim, but in a sense, their diet is not great. They just don't pack on the pounds for whatever, as somebody else might, but they have some of the very same conditions. You really have to kind of be aware.
Right, and so you want to get with your primary care physician or your doctor to talk about, okay, what's my cholesterol? You can look great on the outside, but your cholesterol can be sky high on the inside. So it is important for everyone to get annual wellness screenings.
Is that the best indicator, is cholesterol, or what?
Cholesterol, blood pressure, and diabetes are a trifecta that can really increase your risk of stroke.
And a lot of, millions of Americans are dealing with this. So.
Right, and so making sure you're eating a healthy diet, low in saturated fats and trans fats, and high in vegetables and fruits.
Can you reverse this? If you haven't taken care of yourself by 72, is it just over?
No, I think if you get everything under control and you keep it under control, that your risk of stroke decreases tremendously.
Okay, that's kind of the positive takeaway we'll leave this with. Dr. Sarah Schwertner, thanks.
Thank you.